Hi for everyone, welcome to Dharyaveda. Today in this video we are going to discuss about the very important practically utilized clinically applied drug called Amalaki. What is Amalaki? What is the botanical description and how it is imported in Dravyaguna? Also in the clinical purpose, how we should prescribe, in what condition we should prescribe, and the recent researches what have undergone through the Amalaki drug we will discuss in this video. So let's get started. So what is the basonym of the Amalaki? Amala eva Amalaki dosha shamanatvat. So what is the basonym? What's the word meant by Amalaki? Amala eva, having mainly a Amla rasa. Amala eva Amalaki dosha shamanatvat. Even though it is having the Amla rasa, it does the shamana of the dushita doshas. Generally, as we know, consumption of a Amla rasa, excessive utilization of Amla rasa in a food like a pickle and all, it leads to the pitta prakopa, it leads to the dosha prakopa and cause for a many kind of a disorders. But whereas the Amalaki is mainly a pitta shamaka, also it is vichitra pratyarabdha dravya, nothing but the tridoshagna. So apart from this basonym, it also have a different kinds of a basonym like Amalate dharayati shariram maladharane, that is the one which does the sharira dharana and one which expels the mala out of the body, as it is mrudu virechaka also, and it protects the body like amruta. Then Amlatvena vaisheshyat yatoktam priya nighanto dhatri deha vidharanat malatat dhanat रसेच आम्लता भावाद आमलकी नृणाम हिततमा नित्यम भवेत सर्वता इति. The one which does the dharana nothing but the one which protects, one which withholds the body, that is sharira, like a dhatri. Dhatri is the one who take care of the baby, the newborn child, in the absence of a own mother, or as like that of his own mother or her own mother, like that, as like that of the Dhatri, the Amalaki will does the dharana of a sharira, and Nitya Sevana leads to the Hitatama, that is very best. Tama nothing but the best among the three. It is very best to consume the on a regular basis, which will cause all kind of disorders. Then next comes, what is the botanical name? Embolica officinalis or Phyllanthus embolica. These are the two varieties of Amalaki. Family name, Euphobaceae. Vernacular name, what is locally called as? In Kannada, we will call it as a Nellikai, as everyone know. In Hindi, Amla, and in English, Indian Gooseberry. And in Malayalam, Nelli it called as, and Marathi, Avaleha it is called as. Then what are the synonyms? Why this Amalaki is called by these kind of a synonyms? We'll get to know now. Based on the availability, it is called as Korangaka, that is Koranga Deshe Bhava. The one which is obtained and one which is abundantly grown in Koranga Desha. In nowadays in Tamil Nadu and Andhra Pradesh, also in our Karnataka also, it is grown and Koranga Desha available. And based on a morphology and fruit, that is fruit morphology, it is mainly called as Vrittaphala, that is the fruit will be in a round shape. Vrittam phalam asyaha, globose shape, that's why it is called as a Vrittaphala. Kolam, kola parimanam phalam asyaha, fruit weighs about kola pramana. Kola is the 6 gram. The one single fruit will weighs about 6 gram, that is why it is called kolam. And Tishaphala, Tishye Paushamase Phale Jayate Asyaha, Tisham Manghalyam Phalam Asya iti Ramashrami. Now, Tishaphala means two meanings, one which is obtained in a Paushamasa and also in month of November or December, and in Tisham Manghalyam Phalam Asya iti Ramashrami, as it is auspicious as like that of the Bhagwan Ram. And based on the action and properties it is possessing, it has a synonyms as such. Amrutaphala, first one, Amrutavat Rasayanam Phalam Asyaha, the fruit which is having the properties as like that of the ambrosia or elixir. In a Abhayamalaki Rasayana Pada or in a Rasayana Pada in a Charaka Chikitsa Sthana, first chapter, that mentioned that Karaprachitiya Rasayana Pada, Abhayamalaki Rasayana Pada, we will have all the ingredients, all the formulation. There is the main ingredient is Amalaki, and which gives the Varsha Sahasra and Ajaratva Varsha Ayush and Ajaratva, Buddhi, Srimad Vak, Srimad Buddhi, and all the Shri Kamya, Ayu Kamya, Siddhi Kamya, Aishwarya Prada. So that is Amruta Phala. And also called Amruta, Amrutavat Gunakarini, one which is having the Amruta Gunas, and Rasayanatvat. It does the rejuvenation of the body, it does the repairing of the body, even in the DNA levels. Let's discuss this point in a researches in the Amalaki, where it does the DNA repairment. And namriyante jana akale yasyaha sevanena ityartaha. Why it is called as Amruta? Namriyante jana akale yasyaha sevanena ityartaha. It doesn't allow people to die in like unnatural deaths or prior deaths which commences before the completion of our years, like in case of akala marana, akala mrityu, as we called as accidental deaths. It doesn't make the person to go to that side. Like in a practical manner, it enhances the immunity of the body so that it avoids the many kind of a disorder, whether it may be a bacterial, viral, microbial, whatever it may be. It protects the body from all such infections and all such diseases. By that, it avoid the unnatural, uncommon deaths. Dhatri, as I already said, Dhatri is the one who take care of a child, like that of Dhatriva dehasya dhara poshana kari. Stanyam iva falaraso piyate asyaha. So what is meant by Dhatri? Why it is called as Dhatri Phala? Dhatriva dehasya dharana poshana kari. The one, Dhatri is the one who takes care of the child in a very early stage of the life. So like that, the Dhatri Phala, this Amalaki Phala, takes the dharana, that is withholds the body, and poshan, it promotes and it helps to build the body. And stanyam iva falaraso piyate asyaha. As we have, stanya is the greatest food, or there is no food at all for the baby until the 6 months or 9 months of age after birth. So how that stanya nothing but breast milk, how it protects the body, how it helps to build the body in all dimensions, same like that, the Dhatri Phala Rasa, that is the rasa of the fruit itself, will protect the body. That's why it is called as a Dhatri. And Vrusha, why it is called Vrusha? Shukravardhani, it improves the sexual power, it improves the Shukra Dhatu, it improves the ojas in the body. That's why it is called Vrusha. Vayasya, Vayase Ayushe Hita, Ayushe Ityartaha, promotes the longevity, it enhances the immunity of a body, it enhances the fighting against the aging, it enhances and retains the age, it retains the Yavana Avastha, that is beauty of the body in all dimensions, physically, mentally and socially will be fit and fine, nothing but the health. That's why it is called as a Vayasya. And Shita Phala, Shita Viryam Phalam, fruit possessing the Shita Virya. Even though it is having the Amla Rasa, it has the Shita Virya. That's why it is called as a Vichitra Pratyarabdha Dravya. Also, apart from this, it has the meanings or a synonym such as Jati Phalarasam, Jati Prashastaha Phalaraso Asyaha. The fruit of a medicine, the juice of a fruit is very useful medicinally. That's why it is called as a Jati Phalarasam. Then next comes Varga. In which kind of a Varga? Mahakashaya. Charaka has been mentioned this. In Charaka, the mentioned in 5 Mahakashayas, Kushtagna, it is helpful for the skin enhancement, skin health. So Kushtagna, as in practically we will much use it, in clinically we apply the more number of formulations prepared by the Amalaki for different kinds of kushta. Jvaragna, it is used in Jvara conditions. Kasahara, it is one of the best Kasagna Dravya, Amalaki avaleha or Amalaki Kashaya. The regular consumption or like that of the Naimittika Rasayana, that is the one which acts as a Rasayana as well as the medicinal effect. This acts as the Kasagna. And Virechanopaga, it is a Mrudu Virechaka and helps the main Virechaka Dravya to induce the easy Virechana. And Vyastapana, it is Rasayana is nothing but the geriatrics, one which prevents the early aging or one which retains the youngness. So Vyastapana, Mahakashaya, Charaka has been mentioned this drug. Then what are the different kinds of Amalaki, which are mentioned in our classics. According to Rajanighantu, there are two types of Amalaki, Amalaki and Kshudramalaki. Amalaki will be the Kshudramalaki is nothing but the one which is smaller, what we get in our trees in around our subyards or backyards. That is nothing but the Kshudramalaki. And there are another two types, Vanya and Gramya, one which is widely grown and one which is harvested. And also based on a color we have Krishna, Amrita, Neela and Kanchana. Next, morphology of the Amalaki. So what is the morphology? Swarupa, that is nothing but deciduous small tree. This is a small tree and leaves are type of leaf is simple, arrangement is opposite and having the subsessile leaves, that is a very minute stalk will be there for the leaves, and flowers are greenish yellow and unisexual flowers will be there. And fruit, type of fruit is berry and shape is globose. This fruit morphology is very important as it is the useful part of the Amalaki, so it is very important. And color is yellowish green. Six obscure vertical furrows will be there, the lines will be there which divides the fruit into six bulged particles, and seeds are 3 to 6 in number in each fruit. So what is the chemical constitution of this Amalaki? Whereas the Amalaki is very rich in chemical composition, that too a very good chemical composition which make it to fit that as a Rasayana, having the many dimensional, multi-dimensional activities. Emlicanin A and B, Pangiglucakin, Pendugucakin, 2-keto glucanolactone, vitamin C equivalent, that is ellagic acid, hexadihydroxy, diphenolic acid, amlaic acid, phylanthine, zeatin nucleotide, zeatin riboside, benzonoid, chabulic acid, gallic acid, ethyl gallate, digalic acid, emlicol, ascorbic acid, triturfan, tannin, protein, fat, calcium, and it is the rich source of a vitamin C. And amlaic acid and chabulic acid, gallic acid and all are mainly helpful for the UV protection of the skin and acts as an antioxidant, and it does the healthy keratinization of a tissue. It maintains the skin health and it maintains the calcium level as it is having a vitamin C and iron supplement also in it. So it is good for bone, skin and everything. It is a Rasayana. It protects the Sapta Dhatus, Rasa, Rakta, Mamsa, Meda, Asti, Majja, Shukra. All the Sapta Dhatu it maintains and nourishes. So what are the Rasa Panchaka of this Amalaki then? Vichitra Pratyarabdha Dravya. So what is Vichitra Pratyarabdha Dravya? Vichitra Pratyarabdha Dravya is nothing but one which is Vichitra. That is like having something, the main rules of a composition is different, whereas the when we go in deeper, the actual there is no relationship between the actual main rasa, guna, vipaka, virya and doshagnata and rogagnata. So what is that? Rasa, Amla Pradhana, Lavana Varjita, Pancha Rasa. It is having the all the 5 rasas, not a Shad Rasa, Lavana Varjita. It doesn't contain a Lavana Rasa. That's why usually when we consume a Amalaki, that is nothing but the gooseberry, we'll usually dip it in a salt and spice, that is mirchi powder. We will eat it, or else we will taste it with the salt itself. So what is the rasa of this? Amla Pradhana, Lavana Varjita, Pancha Rasa. So when we consume it with salt, it will be a Shadrasa. As in our classic, Rasatmaka Ahara is the Rasayana best nourishing property. So it is the best drug ever. And what are the gunas of it? Sara, Lagu, Ruksha Guna. Ruksha Guna and Lagu Guna. Vipaka is Madhura, whereas almost all the Madhura Vipaka Dravya will be the Snigdha Guna will be there, Guru Guna will be there, as a Madhura is the Guru, Snigdha and all. But whereas it is having Sara, Lagu, Ruksha Guna, but having the Amla Rasa Pradhana, also undergo the Madhura Vipaka, and Virya is Shita Virya. Doshagnata is Tridoshahara, mainly Pittahara. That's why it is called as Vichitra Pratyarabdha Dravya. According to our rules, Amla Rasa does the Pitta Vardhana and Tridosha Shamaka, and it should undergo Ushna Virya, but it is having a Shita Virya. So it is Vichitra Pratyarabdha Dravya. So what is Karma and Rogagnata as mentioned in our classic? Rasayana. So we indicated in Daurbalya, when in Kshaya Avastha, the Kshaya may be due to iron deficiency, may be due to the Shrama, may be due to the psychological reasons, may be due to the calcium deficiency. Daurbalya in case of not only related to the total body emaciation, it is also related to the Dhatu Gata Kshaya, whereas Rasa Dhatu Kshaya, other Rakta Dhatu Kshaya or Mansa Dhatu Kshaya, Majja Dhatu, Asti Dhatu, the particular, and Shukravardhana, it is Vrisha also, Shukra Dhatu Kshaya, it is indicated. Pramehagna, mainly type 2 diabetes and indicated in Prameha. Kesha Vikara, as it is rich of vitamin C and gallic acid and emlicol and phylanthin. And Kesha Vikara, that is calcium rich, so it is helpful for the hairs. Chakshusha, Chakshu Vikara, Trifalagruta and Mahatrifalagruta Tarpana is the best result what I ever seen in a day-to-day practice. When we do the Tarpana, there will be the last longing effect. We need to do the Tarpana for 7 days and all. Tarpana is nothing but the eye therapy. What we do is Kushtagna and Kushta, many kind of a skin disorder we will indicate. Kasahara Dravya, in Kasa we will indicate as a Naimittika Rasayana. And next comes Amayika Prayoga. How and all we can do the administration of this Amalaki as a single drug Prayoga. And Prameha, mainly first Prameha, the formulation is there Nishamalaki churna, that is Amalaki Rasa and Haridra churna, regular intake at early morning and empty stomach. And also we can also prescribe for the patient at the bedtime at night before the lunch dinner. So Nishamalaki churna clinically tested and proved that it significantly reduced the type 2 diabetes, that is insulin non-dependent diabetes, that is newly onset type 2 diabetes, not the one which is having the complication, one which is having the chronic history, not at that stage also it will help, but it will need another different kinds of remedies and supplements and tablets. Together we need to form a formulation, or together we need to write a prescription. Whereas in the newly onset or acute origin type 2 diabetes, Nishamalaki churna has a very good result, and it along with the dietary supplements. Her dietary supplements is very strict in case of prameha, and it shows the very good results in a clinical trials. And Jwara, Gruta Bharjita Amalaki is administered. So far I haven't tried, but it will definitely help. Gruta Bharjita Amalaki administration, that is how we need to do. We should take the Amalaki fruit, fresh fruit, or we can also take the dried one, and we need to if it is the fresh fruit, we need to remove the seeds of it, and we need to pound it, crush it. And gruta bharjana, nothing but the frying with the gruta, the freshly go gruta is need to be taken, followed by Ushna Jala Pana should be strictly administered and continued to the Ushna Jala Pana, or else he will have the congestion of a throat and jwara going to be increased if he drinks cold water. Pandu Amalaki avaleha or Amalaki churna should be mixed with madhu, and it should be administered in lickable form, not to consume lickable form. He should lick, followed by the milk or followed by the hot water we can administer to the patient. How to administer this Amalaki avaleha in a lickable form? Patient has to lick it, consume the Amalaki avaleha, followed by, if he is a Niramavastha, he is in Niramavastha, you have administered Deepana Pachana Dravyas prior to administer, you must administer the Deepana Pachana Dravyas as such of Agnitundi Vati or Arogyavardhini Vati is best 5 to 10 days. You should administer it after the 5th day or after the 3rd day, 4th day. You should start the Amalaki avaleha with the Arogyavardhini only. Agnitundi Vati or Chitrakadi Vati, Sutashekara Rasa, whatever the tablets you may prescribe in a BD, that twice a day, followed by hot water. Then you administer the Amalaki avaleha. We will have a best result in iron deficiency, anemia. And Kamala, Draksha and Amalaki Swarasa is very important. Draksha is also Mridu Virechaka, whereas Amalaki is also Mridu Virechaka and Virechanoppaga. So Kamala, there will be affection of a liver. Ekrutodaka drugs we need to prescribe, that is bilirubin and biliverdin will be increased in a blood, increased in a urea, so it helps for excretion, and discoloration of a stool will be there, Pita Varnata of a stool will be there, which does the Virechana and stabilizes the health. Then what is the useful part? As we know, the useful part is phala, the fruit. And what is the matra? Standardized matra, churna 3 to 10 gram, kvata 50 to 100 ml, swarasa 10 to 20 ml. It's okay to consume in excess. It is the good drug only, not in too much quantity, but it is okay. You can give in a liberal dose, no restriction for a dose as such. Depends on the condition of a patient, bala of that patient, and the dependence of or demand of the particular disease, what it does. Based on that, we can prescribe. There is no worry. And yogas, Amalaki Rasayana, Amalaki Kashaya, Triphala Churna, the famous drug every student will use to write, and even me too. And Triphala Grita, Triphala Kvata, Nishamalakadi Churna, type 2 diabetes, Brungamalakadi Taila, that is for the Kesha, Dhatri Arishta. The etc. preparations are mentioned by about the Amalaki. So let's see that how this Amalaki is given the importance in our classics. That is our supreme samhita, that is Charaka Samhita. Charaka Samhita, Chikitsa Sthana, it started with the Rasayana Pada. Nothing but the one which Rasayana Pada is, Rasayana is nothing but a particular separate branch of Ayurveda itself, a geriatrics branch. So it is a separate branch, and in Chikitsa Sthana, Charaka given the prime most importance to the Rasayana, and in that the first pada is Abhayamalakiya Rasayana Pada. Pada is nothing but the part of Rasayana Adhyaya. Rasayana Adhyaya and Vajikarana Adhyaya each have the four padas, that is nothing but the 4 parts of Adhyayas in each unit. What we have. There are four are there in Abhayamalakiya Rasayana Pada. As name it indicates, Abhaya and Amalaki. Abhaya is the Haritaki. Haritaki is also the same equal important drug, which is like when we don't know the disease, when we don't know the treatment, if we need to give the potency or symptomatical relief or some relief to the patient, Abhaya and Amalaki are the 2 important drugs which definitely give the relief for the patient. So Abhayamalakiya Rasayana Pada. Main important Rasayana drugs are Abhaya, that is Haritaki and Amalaki. So the chapter name it itself the Abhayamalakiya Rasayana Pada. So what is mentioned in that Pada? In that Pada, Kuti Praveshika Rasayana, that is nothing but the Rasayana to be taken inside the Kuti. For a particular duration, a person has to stay in a hut or specifically and particularly designed home or home itself. In that he should avoid every external contacts, and he should reside and he should consume a rasayana, by which we will see the miraculous results. As we say, like in olden days they will have the Ashta Ishwaryas, Ashta Siddhi, they had that capacity there. They will they've lived for 800 years, 1000 years, like that we will have a result by that. 800 is not possible by this era. Some extent we can. So what are the different formulations? Brahma Rasayana, this is the best Rasayana, Kuti Praveshika Rasayana. In that the main drug is Haritaki and Amalaki. Prathama Brahma Rasayana, Dvitiya Brahma Rasayana also. And we have Chavanprash. In Chavanprash is like the life savior of nowadays. Chavanprash is the main ingredient is the Amalaki. Because of the Amalaki itself, it has that much potency. And Amalaka Rasayana itself, it is mentioned. And Haritakyadi Rasayana, it is the main ingredient. And next comes in Pranakamiya Rasayana Pada, the one who calms the longevity. Pranakamiya is nothing but the one who wishes for the longevity, long years long lived for those people. In that chapter, Amalaka Gruta, Amalaka Avaleha, Amalaka Churna, all are mentioned about Amalaki only. And Vidanga avaleha, Apara Amalaka avaleha, and another one Amalaka avaleha is being mentioned. So like this type, there's so many formulations of Amalaki are being mentioned in our classics, and it given the prime most importance. And in Charaka Chikitsa Sthana first chapter, that is Abhayamalakiya Rasayana Pada, he mentioned that Tan gunan sthani karmani vidyad amalakishvapi yan yuktani haritakya viryasya tu viparyayaha. Acharya Charaka, that is Agnivesha, has been mentioned that guna of a Haritaki before this shloka. And later onwards he is saying that Tan gunastani karmani vidyadamalakishvapi. Amalaki is having the similar properties as like that of a Haritaki. I'll say this next. Yanyuktani Haritakya Viryasya tu Viparyaya. Whereas Amalaki is Shita Virya, but Haritaki is Ushna Virya. Amalaki is similar in all the properties as like that of a Haritaki, but it is having a different Virya. Haritaki is having Ushna Virya and Amalaki is having Shita Virya. So, what is the importance or what is the guna of the Amalaki then? Then doshanulomanim, lagvim, vidyat, deepanapachanim, ayushyam, paushtikim, dhanyam, vayasaha stapanim param, sarvaroga prashamanim, buddhi indriya balapradham, kushtam, gulma, udhavartam, shosham, पांडवामयम मधम अर्शांसी ग्रहणी दोषम पुराणम विषमज्वरम हृद्रोगम सशिरोरोगम अतिसारम अरोचकम कासम प्रमेह आनाहम प्लीहानाम उदरम नवम कफप्रसेकम वैस्वर्यम वैवर्ण्यम कामलाम कृमिन श्वयतुम तमकम छर्दिम क्लैब्यम अंगावसाधनम स्रोतो विबंधान विविधान प्रलेपम हृदयोरसोः स्मृति बुद्धि प्रमोहम च जये शीघ्रम haritaki. He mentioning the haritaki. Also it is having similar properties of amalaki. So it has this much importance. Doshanulomana, it does the vatanulomana. Doshanulomana expels the vitiated dosha from the body. Lagvi, that is easy for a digestion, not so much hard for a digestion. So we can indicate in a ama condition. We can indicate it in a diseased one without thinking anything. Vidya deepana pachaniyam. It does the ama pachana. It imparts the health. It increases the digestive capacity of a person, by which it mitigates every kind of a disorder, as the Agni is the primemost thing to treat. Ayushyam, it imparts the longevity. Paushtikim, it gives the strength to the body. Dhanyam, it blesses the body by increasing the immunity, by increasing the youngness, by increasing the beauty, by enriching the mental and physical health to the body. Vayasaha stapani param. It is Shrestha Vayastapaka Dravya. It's Shrestha for keeping us a healthy and young. Sarvaroga Prashamanim. It mitigates every kind of a disorder. Buddhi Indriya Balapradham. It imparts the strength, it imparts the intellectuality to the person, and it imparts or sharpens the senses of a person. Kushtam, and indicated in a Purana are chronic diseases. It able to cure chronic diseases such as kushta, that is a skin disorder, different kinds of skin disorders. Gulma, udhavarta, that is upward movement of a vata. Shosha, that is emaciation. Pandvamaya, nothing but the iron deficiency anemia. Madham, the madham is nothing but the confused state when lack of interest in a body, maybe due to interest in the day-to-day activity, maybe due to the stress, maybe due to the physical strain, maybe due to the disease inside them. For many of the reason, there will be a mada. It subsides that, the cause as well as the symptom. Ashamsi, the piles. Grahani dosha, the irritable bowel syndrome as a sprue or indigestion, chronic indigestion, ulcers in the body, or acidity, gastritis, everything it will subside even though they are chronic. And Vishamajvara, the chronic repetitive jvara, repeat occurring jvara. Hrudroga, the cardiac disorder, as Amla Rasa is Hridya. So Hridroga is mitigated. Shiroroga, the headaches, different kind of a Shiroroga. Shirokapalagata rogas as Kesha Sputana, Kesha Chutti, Kalitya, hair fall, premature graying of a hair, thinning of a hair volume, everything it will chugs. And Atisara, it also mitigates Atisara. Arochaka, it anorexia, that is the loss of appetite or loss of taste in the food. It will corrects that. And Kasa, as an Ayurvedic Rasana, has already told, prameha nashanam, that is type 2 diabetes. Anaham, that is abdominal distension. And plihanam, the splenomegaly. Udaram, udara is nothing but the accumulation of ascites we can take, accumulation of the free fluid in the peritoneal cavity, which is like, as I have seen many of the condition, it is very difficult and be with the udara, but we have a very good result with Amalaki. Kafa prasekam, Vaiswaryam, This all these symptoms now they should be acute origin, then Amalaki will definitely help. Kapha praseka, then kafajakasa, kantagata vikara, the next they are saying kapha praseka, vaisvarya, harshness of a voice, vaivarnya, discoloration of the body as it is tvacha, kushtagna, and kamala. Kamala is jaundice, it corrects the jaundice. Crimin, it is very good proven antimicrobial, so it mitigates the crimi. Shvayatu, the shofa swellings in the body, inflammatory. It reduces the inflammation in the body. Tamaka, that is bronchitis, allergic bronchitis, all the respiratory disorders. And chardi, even though having the amla rasa, it is responsible for mitigating of a chardi, nothing but the diseased pathological vomiting. And clibia, it is vrusha. Clibia is impotency as it is vrusha. It mitigates the not mitigates, it increases the potency of a person, also increases the shukra dhatu and sexual capacity of a body. And anghava sadhanam, the emaciation of the body. Sroto vibandhan vividhan, it clears the vividha riti sroto. Then what are the recent researches carried out in Amalaki? Some of them I am going to tell now. Amalaki Rasayana, it tested for a clinically, then it shows the DNA repairment. As we are exposing our body to the many kind of DNA damaging, gene damaging things such as UV radiations and hot sun rays. Nowadays the peak sun rays will be there and sunstroke will be there, which increases the chance of early aging, increasing the early aging of the skin. And in that condition, against UVB induced photo aging in human skin, fibroblast via its strong ROS scavenging ability, the Amalaki Rasayana is proved to decrease that aging process, and it helped to repair the DNA which is destroying by the UVB induced photoaging. By the ROS scavenging ability. What is ROS scavenging ability? A chemical substance added to a mixture in order to remove reactive oxygen species, nothing but the antioxidant property. It is curing the skin from the photoaging, that is due to the UV reactions, UV radiations from the sun. Also this is DNA repairment. As I have already told that type 2 diabetes, it is decreased, very significant result are there by the Nishamalaki churna or Amalaki. And Amalaki is proved for the hypolipidemic effect. Hypolipidemia is nothing, hypolipidemic process is nothing but a decrease of a bad cholesterol which is deposited in the body. By that there is a one of the cause for diabetes is the hyperlipidemia. Complication of a diabetes also hyperlipidemia, by which they suffers a lot, and obesity also decreases by it, and it has the marked effect in atherosclerosis. Decreasing hypolipidemia is deposition of various things, lipid in or bad cholesterol in blood vessels, leading to the pulmonary embolism or heart attack or cardiac failure will be there. Embolism if occurred, then there is a cardiac failure, ventricular fibrillation, ischemic heart diseases are going to happen. So marked effect in atherosclerosis will be there, and significant reduction of blood pressure is also noticed by the atherosclerosis, reducing the atherosclerosis and decreasing the hyperlipidemic condition. It marked reduction in the blood pressure has been seen by using the Amalaki. As mentioned in our classics, Amalaki is the best rasayana, one which cures every kind of a disorder, and it also helps for the maintaining of a longevity. As we said, akala mrityu, it prevents us from the akala mrityu, nothing but all these effects on a regular consumption. And it is also nitya sevaniya ahara dravya and nitya sevaniya rasayana. So consume the Amalaki and do consume, prescribe for your patients. Let them to be happy. Thank you.